This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about why you shouldn't remove your cast at home. If you like this video, we put out new content weekly, so please like and subscribe. So why you shouldn't remove your cast at home? I'm sad I have to make this video, but every once in a while I get a kid or adult or somebody who I cast, and nobody ever misses the cast off appointment. They're usually begging to get that appointment, but some people just disappear, and I think a lot of them end up removing it on their own at home. So why should you not do that? First of all, there's a reason why the cast is on there, and that's usually to hold the bones in place to prevent swelling or something like that. So you taking it off prematurely can be a really bad thing, especially if the bones were sort of reduced, meaning that someone pushed the bones back in place and the cast is there to sort of hold everything, or you have a fracture in a kid's forearm. Taking it off early could cause the bones to shift, and it might take something that didn't need surgery into something that did need surgery. Also when someone is taking your cast off, whether it's when a professional does it, they're usually getting x-rays at the time to make sure everything looks okay and then releasing you to activities. So they're essentially skipping that whole step, which is obviously not a good thing. Sometimes things feel better, but you still need to be cautious with them, and just removing the cast and going at it is not always the best thing. The other thing is that there's an art to removing a cast. There's a special saw that I have, and it has a blade. Instead of spinning around, it just vibrates, so it doesn't cut soft things, because it'll just sort of move the skin, but it'll cut hard things. And that's how cast saws work. It's a very specific type of saw. And most people end up taking these casts off. They don't have this saw. They end up using bolt cutters or Dremel tools. So you can obviously cause a lot of damage when you do that. You can even cause damage with a cast saw if you use it incorrectly. Meaning that if some people drag the blade or push too hard, you can still cut the skin or cause burn marks if you handle it incorrectly. So there's a certain art to do it, and where you're making the cuts to make sure you're not cutting over structures that may become damaged. So the moral of the story is, if you think you need your cast off early, go see your doctor. Tell them why. Maybe they put it on bad. Maybe it's pushing on the skin. Maybe it's rubbing. Maybe something feels bad. Maybe it's infected underneath. I don't know. If that's the reason, go see your doctor. They can take it off, examine it, put a new cast back on. Don't do it yourself. And it's just not. It's not the right. It's not going to be good for you long term. Yes, some people probably get away with it, but you're really putting yourself in a bad position unnecessarily. So I hope I was able to give you some sense as to why you should not take your cast off at home. I highly don't recommend it. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any medical advice, because this video and all my videos are for educational purposes only. Thanks for watching.